The former Minister of Health, Professor Isaac Adewale, told the 8th Senate recently that if the condition of primary and secondary healthcare centers is not improved across the state, the tertiary health institutions will continue to be overstretched with conditions that should be treated in them. Our next report takes a look at the state of primary and secondary healthcare centers and what must be done to reduce the burden on their tertiary counterpart. Our correspondent, Mary Alale Yusuf, has this report.
This primary healthcare center in Yola, the Adamawa state capital, boasts 24-hour services. Tastefully built and with modern equipment in good condition. From the look of it, the state also has decent secondary health centers. Primary and secondary healthcare centers in Uyo and parts of Lagos are also presentable. Some are pretty busy. It wasn't always the case. This was and is still the look of many healthcare centers in other parts of the country.
When this government came in 2015, there were some of our hospitals that did not even have doctors. But I can tell you that as it stands today, there is none of our secondary facilities that is not being manned by a doctor, a pharmacist, a medical lab scientist.
The primary healthcare system has been described as the base of a pyramid because most health seekers are expected to have simpler problems which can be handled at this level. More difficult cases, which are fewer, can be referred to the secondary level higher up or the tertiary level at the top of the pyramid. Once upon a time, according to some experts, primary and secondary healthcare centers bustled with activity. But the story changed, partly owing to neglect and lack of maintenance.
They will tell you the building is collapsing. Nobody goes there. The place looks unkept. They will tell you when we go there, even when we find a doctor or a nurse, they have no drugs.
This unfortunate trend, according to the former Minister of Health, Professor Isaac Adewale, has weakened the health system with the result that tertiary centers are overburdened. Under the National Health Act of 2014, basic health is to attract 1% of the nation's consolidated revenue to form the Basic Healthcare Provision Fund. 50% of this is to be earmarked for health insurance. 45% for primary healthcare centers across the nation, and 5% for emergencies. Monies for this fund were only released in 2019 for a number of states.
It was only released this year for the first 9 states. If we do a phased program, a phased release of the Basic Healthcare Provision Fund to states, then we might not see the results which we want to see.
Things are looking up, some Nigerians say, but there's still a lot that needs to be done.
The people themselves are not really aware of these health services and what these health services provide.
After being trained here, they are traveling out, going for greener pastures.
The situation has become so bad that the executive director of the National Primary Healthcare Development Agency declared a state of emergency on maternal and child mortality, sectors dealt with mainly at the primary healthcare level. At about 560 deaths per 100,000 live births, the maternal mortality rate has been described as alarming in light of the fact that many of these deaths are preventable. The problems of the health sector transcend its walls, such that if doctors, drugs, and equipment are in adequate supply, lack of electricity, water supply, and security would still undermine health outcomes. Mary Alale Yusuf, Channels Television News.
Now let's examine this issue further, and joining us to discuss it is the General Secretary, Association of Public Health Physicians of Nigeria, Dr. Doyin Ogunyemi. It's a pleasure having you join us on the News at 10.
Thank you for having me.
Now, how important is it for these primary health centers to be able to stand on their feet and deliver quality healthcare to the majority of Nigerians?
Primary healthcare is the first point of entry to the health system. Ideally, you should go for your regular preventive care, immunization, antenatal care, and treatment of primary care illnesses first at the primary health care level. And then you then go for referral to the higher. So it's so important because ideally this kind of healthcare should be accessible to all. The community should be part of what is happening in the primary healthcare center. It's the basic healthcare. You should be able to walk there. It should be at least 30 minutes from wherever you live. If it's a health post, a health center, all those that are at the primary care level. So it's so important. If the primary care healthcare is functioning well and it's good quality, you wouldn't have people going to the secondary, so much influx into the secondary and tertiary health centers.
That's right, Dr. Oguyemi, and that brings me to my next question, because the tertiary health institutions are overstretched. So how can we make the primary health centers function optimally?
Well, we have to go back to the basics, and normally what should happen is that the primary health care should be at the local government level, meaning that it should be manned at that level. So if we are able to strengthen that to some extent and improve funding at that level and manpower, because I think those are some of the problems. You get there, the manpower is not there, drugs are not there, infrastructure is deficient, they are not able to run efficiently as they should, and so people bypass it. So if we're able to strengthen that aspect, and in terms of distribution, we have more in urban areas than rural areas, and even within cities we have more in more urban areas. So if we're able to strengthen the manpower, strengthen infrastructure at that level, more people would be able to use the primary healthcare center.
So what are the roles of the state and the local government in this regard? I know you mentioned something about the local government trying, at least they should chip in to make sure that...
So the primary healthcare board normally would oversee the primary healthcare centers, but they're still under the Ministry of Health in the state. So they give the oversight functions as states to what happens at the primary healthcare centers. So in terms of supervision and making sure that things are run, trainings and all of that, that is what should happen. So I think a little more strengthening of what can be done at the level of the local government. And if essentially this can be done at that level, you would have better strengthening of the primary healthcare center.
Now let's talk about the distribution of health workers between the urban and the rural areas. They appear to be lopsided, and a lot of people would not probably like to go to the rural areas to practice. So how do we get them to be attracted to those remote areas?
By developing the remote areas as well. If people are going to work there, you want the roads to the place to be more tolerable. You want a bit more security in those areas. You want other infrastructure, schools. Remember that whoever is going to work there also has a family. And so I think that there should also be incentives. So if I go and work in a rural area, pay me a little more than somebody who works in there. So make it very attractive.
Make it worth my while.
Yes, and then, you know, put the facilities there. People should feel secure and feel that they are part of the system, even if they're in the rural areas. So I think it's a whole lot of all of that working together.
Thank you so much, Dr. Oguyemi. It was a pleasure speaking with you on the News at 10.
Thank you.
To other stories now. Barely 24 hours after the court ordered that status quo be maintained in the suit challenging the suspension of Dar Communications broadcast license by the National Broadcasting Commission, the regulator is insisting that the Africa Independent Television and Ray Power 100.5 FM are still breaching the broadcasting code even after their licenses were restored. According to a statement issued by the Assistant Director in charge of Public Affairs, Mr. Antia Ekanem, the NBC noted that the court order was filed by Dar Communications PLC before the directive to suspend the broadcast license was issued. Dar Communications stations, that is the African Independent Television, AIT, Ray Power and Faji FM, have all resumed transmission. Let's cross over to the world of business now, where Kayode will be telling us what the CBN is trying to drum in.
Well, that's right, Melinda, and you're welcome to Business News. Central Bank Governor Mr. Godwin Emefiele says there is a need to strengthen efforts to stimulate growth and create jobs in critical sectors to insulate the economy from global shocks over the coming years. Mr. Emefiele spoke today at a consultative forum with some economic stakeholders in Lagos, an event which also was attended by the Lagos State Governor, Mr. Babajide Sanwo-Olu. The CBN chief explains that discussions and comprehensive recommendations will form part of the roadmap that will ensure that the Monetary Policy Authority implements measures that will drive the growth. Mr. Emefiele also hints that the financial markets regulator had taken a number of actions in the last 5 years to support the growth of the economy, which has helped in achieving macroeconomic stability. We will stay with that event where the CBN governor says that the bank's monetary policies are developed out of a guiding principle against the rapidly changing global environment. Mr. Emefiele highlighted this point after the roundtable with some top policy and business leaders in Lagos to clarify the regulator's position on some of its monetary policies and actions.
Basically, what we're saying here is that we want to give them opportunity to, I'll use the word, to vent their views about what they think the Central Bank of Nigeria, the Monetary Policy Authority, should be doing in the next 5 years to support the economy and indeed to support the growth of the economy. One thing that has been made clear so far as the groups go into their working sessions is that there is a need for us to develop policies that must support the weak, that we must develop policies that must support the vulnerable. And the vulnerable means those who are in our rural communities. We must do everything possible to make sure that we create jobs for them. We must improve the level of, increase the level of employment in the country so as to ensure that those who feel abandoned, those who feel they have nothing to do, can get busy again. There's a need for us to grow the economy. Nigeria's economy, yes, is the biggest in Africa, but I think a lot still needs to be done, and that's the reason why we're here today.
Well, let's head over to the Nigerian Stock Exchange, where the first trading week of June ends in negative territory after investors extended profit-taking in key blue-chip equities across all 5 sectors of the market. The NSE's main index dipped by 2.05% at 30,432.13, while its total value plunged by 2.06% or 242 billion naira in 3 sessions to 13.402 trillion naira on intense sell pressure, particularly from the oil and gas sector components. 44 equities recorded price load shed, led by the trio of NEM Insurance, Capital Oil and Consolidated Hallmark, which fell by over 13%. Champion Breweries is highest among 15 gainers, up by 18.81%, while 109 equities remain unchanged within the week. The shares of GT Bank, UBA and FCMB are lead contributors to a total of 768.98 million shares worth 12.54 billion naira, which were all traded in 11,291 deals within 3 trading sessions. More stories now. The Nigerian Gas Marketing Company has announced a profit after tax of 12.47 billion naira for the year ended December the 31st, 2018. According to a statement issued by its parent company, the Nigerian National Petroleum Corporation says the NGMC's performance was impressive, considering challenges the company faced in its operations, particularly from pipeline vandalism. The NNPC noted that the company's total revenue for the year 2018 dropped to 243.63 billion naira. This is compared to 275.16 billion naira in 2017, following a move by electric power generating companies to purchase gas directly from gas producers since June 2018. The NGMC, which is a subsidiary of the NNPC, is mainly engaged in sourcing, marketing and distribution of natural gas to major industrial users and utility companies in Nigeria and the West Africa sub-region.